Now this is the heart. This is the heart. I showed you the area of the heart, and so far this I am not seeing any cardiac activity. No cardiac activity at all. So this is intrauterine fetal demise. So you see that the abdominal structures are not that clearly visualized. This is the chest, this is the diaphragm, this is the liver. This is the diaphragm, this is the chest, and this is the liver. Is there any movement of the fetus? I will keep the probe here for a while and would like to see if we see the movement of the limbs or not. No movement. Now see the movement of the abdomen. See, there is fluid within the abdomen as well. This black line, this is the wall of the abdomen. It is thick, and there is fluid within the abdomen. These are the abdominal organs, especially this one is the liver. So this is a study of and that was one of the reasons why we couldn't get the proper abdominal circumference. The abdominal circumference is the only measurement which is showing 25 weeks. So IUDR is understandable, keeping in view now these are abdominal organs gathered together, and this is the fluid within the abdomen. The wall of the abdomen is so thick, there is no movement whatsoever in the fetus, and the fetal lie is transverse. This is a transverse fetal lie with absolutely no fetal movement. Transverse lie because of. Now this is a case of intrauterine fetal demise at 26 weeks gestational age because and IUDR, and the reason is this umbilical cord, which is bead shaped, or it has knots with polyhydramnioles. You see, this is the esophagus fluid pocket. And the fetus is pushed with the posterior wall of the uterus by the significant amount of fluid that is the cause of pushing the fetus with the posterior wall. Now I'm keeping the probe there, and we are not able to see any movement except when I move the probe myself. No fetal movement, no cardiac activity, no breathing. Little movement that you are seeing is because of the mother's movement, breathing movement. Otherwise, the fetus is not moving. No movement of the limbs. Normally, at this stage, the fetus is very active, and you will not see these limbs at one place. It becomes difficult to grasp a good view. Here we see the child is not active at all. So, as I started the ultrasound, I had a different impression. As we went on performing the ultrasound, we have come to another very different conclusion, that this is a case of intrauterine fetal demise at 26 weeks gestational age, and polyhydramniosis because of the same reason. And the cause is the beaded or knotted umbilical cord. Is there any sign of fetal distress? Or did the fetus go into distress? Meconium. Do we see meconium? You see, whenever you see a double line or double cranial, it is always suggestive of intrauterine fetal demise, and along with it you can see there is overlapping of the fetal bones, the fetal skull bones. This is a very rare case. Very rarely when one comes across, and I am going to magnify to show you the beaded appearance of the umbilical cord. Now this is the umbilical cord. Now this is the umbilical cord. This structure, this linear structure, the umbilical cord. A magnified view. So there is no meconium seen, which rules out any possibility that the fetus went into there was any fetal distress. This is the cause. So now here we see there is polyhydramnios, there is fetal demise, there is no fetal activity seen, and there is no cardiac activity seen. There is beaded form of umbilical cord which is collapsed totally, no vessels, no patent vessels seen, which is usually two artery, one vein. And this gives us the total story of this case with polyhydramnios, where umbilical cord is the cause for the development of all the findings that we did see. And this is our case of the day. Very rare case, rarely seen. This is the face of the fetus, head of the fetus. This is the face, eye, mouth, body, limb. This is body. This is the umbilical cord. This is the placenta. जरा एक मिनट जी Thank you very much.